Okay. Hello, everybody. So we're going to do introductions in a moment, but I just wanted to let you know, because we're talking about grief and trauma tonight, one of the things I wanted you to experience is a trauma-informed practice. So one of the things that we do for kids who have experienced trauma in the past or are part of trauma-informed care is something that we call previewing. So this is a preview of what we're going to do tonight. So this is you receiving a trauma-informed presentation, essentially. So now you can feel what it's like. This is something easy to incorporate into work, home, school. The idea is knowing what comes next helps you feel safe so that you are not always waiting for the unexpected to happen. So for kids, this is really important. Kids like to know what happens next. Little kids may ask frequently, like, what's happening next? They may be like, when are we doing that? When are we doing this? This tells you our little roadmap for tonight, just so that you are aware. And so, again, this is something that's easy to incorporate into any other service that's provided, into schools, at home, into your daily routine. And this is not just for kids, but for anybody. So now, not only are we going to talk about all these things, but you are receiving trauma-informed care as well.
Excellent. Good evening, everyone. I'm Heidi Porter, the Director of Health and Human Services for the town of Bedford. I'm here tonight with my colleague, Mallory Fuller. She's the Youth Services Coordinator for the town who facilitated bringing you this event tonight. And we're also here tonight with partners from the Bedford Public Schools, Board of Health, and the Edinburgh Center. There's a lot going on in our lives, our local Bedford community, at the state and federal level, and worldwide. Knowingly or unknowingly, these events can impact us significantly, be overwhelming, and hang heavy over us at times. Recognizing this, Bedford Health and Human Services Department and the Bedford Public Schools partnered with the Edinburgh Center to host this workshop to help us all understand trauma and grief, its impacts on our mindset, actions and reactions, and offer us some tangible tools for our toolboxes to mitigate the effects of grief and trauma, offer support, and provide resources available in Bedford and beyond. To shepherd us along this journey is Joanna Wu, who opened the evening tonight. She's with the Edinburgh Center. She has worked with families and children for over 15 years, in particular looking at the long-term impacts of early childhood trauma on a person's development. Joanna is currently finishing her master's degree in clinical mental health counseling and trauma studies. This is her second year as a clinical intern at the Edinburgh Center, working in the first episode psychosis program, as well as seeing individuals and families for outpatient therapy. Over the last year and a half, Joanna has worked with a number of Bedford families, attended students' IEP meetings, and worked collaboratively with school counselors and teachers. She also works for an app-based parenting network called One Huddle as a child development and parenting expert. Joanna also privately works with individual caregivers and families, providing parenting education, coaching, and therapeutic support. I have to say, when we recognized in having discussions with our school partners and some community partners as well, the need for this type of a workshop, and we brought it up with our new partners at Edinburgh with Pam, who's here tonight. They knew that Joanna was the person for the job, so we're really excited and really happy to have her here tonight. So I welcome Joanna to the podium to start our workshop. Thank you.
I'm Ainsley Killingstad. I'm an outpatient clinician with the town, with the Edinburgh Center, and I'm also I work with the town of Bedford Youth and Family Services Department. If any of you would like to speak with me about that afterwards, I'm happy to go into more detail.
Thank you. Do you want to have a seat, or do you want to sit? Okay. Okay. Well, thank you everybody for coming tonight. As odd as it may sound, this is like my favorite topic to talk about. So please stop me if I use like a clinical term that you're not sure about. I tried to remove any acronyms that would be confusing, but feel free to stop me if you don't understand a concept that I'm talking about, because I could go on and on and on. I'm gonna try not to do that though. So first, we're gonna talk a little bit about what trauma is. You may hear people say things like, that was so traumatic, or like, oh, I'm traumatized now. It's become kind of part of our vernacular and just the kind of, thrown around very casually. Similarly, people might say like, oh, I like my house to be clean, I'm so OCD. And that's not like actually what OCD means. Just like saying, oh, I failed that test, like I'm gonna be traumatized from this. That's not what trauma is. So an actual traumatic experience is something that happens that makes you feel incredibly unsafe due to the stress from or the threat of intense, painful, or scary events. Now, this is the most kind of broad definition that I could find for tonight. It can be very specific. When we're diagnosing something like post-traumatic stress disorder, often we're looking at things that feel life-threatening, even if you're not actually being threatened in that way. So it has to be that kind of level of intensity, though. So like failing a test, being broken up with, like those are not traumatic events. It may feel really horrible, but that's not what trauma is. Traumatic events have negative long-term effects on daily functioning and on your mental and physical health and your social, emotional, and spiritual well-being. So it's something that really affects every aspect of your life. Because everyone's different, your ability to manage a high level of stress is also different. So it means something that I might find very stressful and scary might not be a big deal to somebody else. Similarly, something that I find to be slightly concerning or worrisome might feel life-ending to somebody else or world-shattering. It's totally different for everyone, so this is very subjective. So someone can't say to you, like, that's not scary, or that's not trauma, or you didn't have that happen. It's a very individual experience, and it's different for everybody. So part of our job as clinicians is to also help you figure out what happened and what that really means to you. One of the things that makes an event potentially traumatic, especially for children, is having that experience alone. Being left alone with your thoughts and feelings that are very scary and stressful, like this traumatic event potentially, is one of the worst things that can happen, again, especially for children. Being left alone with those feelings is terrifying. Connection to other people is critical to recovery and healing. So one of the things I hope that you'll take away from tonight, if nothing else, is that healthy, supportive relationships can help you through almost anything. That is kind of the number one key to recovery, healing, moving forward, getting past something, is having really deep connections to other people in your life. Oh, and you may have heard the term complex trauma or developmental trauma or CPTSD. These are also terms that are kind of talked about a lot on social media these days. Kids might say things like that. Complex trauma is different than kind of regular trauma, if you will. It's experiencing chronic, meaning like very, very ongoing, not like one or two things. Traumatic events that are particularly severe and interpersonal. So often we're talking about things like child abuse or neglect, and that also can have a very different outcome and a different look to it. But something like that is traumatic could be a car accident. That could be traumatic for somebody. So experiencing 15 years of child abuse is extremely different than getting in a car accident, even though both can be horrifying, and difficult to move past, and you can have a lot of symptoms kind of throughout your life. This is kind of there's a different category for that. And these are just some examples. I'm not going to read every single one to you, but examples of things that could be traumatic that you may not even realize could impact somebody quite so deeply. So, things like abuse, that may seem obvious. That, of course, is a terrible thing to go through. But things like discrimination, a natural disaster, like COVID-19, that was a kind of cultural and social trauma that we all went through together. And just because you might feel okay about it doesn't mean that everybody feels okay about it. And for some people, that was really life-altering, being locked at home with maybe people that you didn't want to be locked at home with. The loss of jobs. There were like so many kind of widespread impacts from that. So it's important to remember that it doesn't have to be something as kind of obvious as a car accident or abuse. There are kind of subtler things that can still really deeply impact us. And also like loss or separation from a parent. So like if a kid, regardless of age, has a parent who's then incarcerated, that sudden kind of jarring transition and all of the kind of outward ripples from that can be really difficult to integrate into the rest of your life. So that can be something that's traumatic, and even though we don't think of it as maybe being that kind of like to that level, if you will, because we think, well, like they're still around, or they'll come back, or you can still see them. So anything that you find to be that overwhelming can really impact your life very significantly. Okay, so similarly, grief also is experienced many different ways. And there's no right or wrong way to deal with your grief or an important loss. Something that I do want to point out is that similarly to trauma, there can be many things that we grieve that we don't realize we're grieving. It might feel obvious to grieve the death of a loved one or a pet or, loss of your career. There are things that feel like they're kind of worth that kind of intense emotional experience. But loss is a universal experience. Everyone deals with it differently, though, depending on lots of different factors. So we may have non-death losses that you may feel sad about, but if you're wondering, why am I still so sad that I never got to, be an actor? You may be really grieving the loss of a dream or a future that you really thought you were going to have. And if you don't let yourself kind of acknowledge what that is and really acknowledge it as a loss, it might be really hard to move past, or you might always have a little bit of resentment down deep about whatever, took your dream away or your parents didn't let you try. So there's lots of things that you might be grieving, but you don't have the name for it, or you don't know to label it that way. So these are just examples. This is certainly not a comprehensive list. It can be anything, but having the kind of knowledge to give yourself permission to acknowledge these kind of very deep, again, it could be life-changing losses, is really important, because if you don't let yourself feel the grief or feel the anger or feel whatever it is, it kind of sticks with you. Something that's just good to note, there are times that somebody's grief is more complex, which we would call complex grief or complicated grief or prolonged grief, which usually involves really difficult circumstances or very extreme symptoms that interfere with someone's ability to live their normal life. So if somebody is grieving the loss of a parent or a spouse and they don't seem able to move past it, they're not wrong, but they may need further help, because there are times at which we get very either stuck in this moment, we don't have the coping skills to move on, we don't know how to deal with it, we don't even have the words to explain it. And so that is just one of the things that's, since this is obviously what we're talking about tonight, it's important to note that that's something to look out for. Just because you do want to know when to find further help, obviously that's what Ainsley and I are here to explain to you, but it's good to know that there are people who are here to help you through that. So if you or somebody else is grieving and it feels endless, it feels like it's never going to go away, that's the time to reach out for further help. Grief is considered to be complicated or prolonged in kind of our lives, our world, when you have severe symptoms like not believing it really happened, feeling emotionally numb or shut down, feeling hopeless, or intense emotional pain. And this would be for a year or more after a loss happens. There's also different kinds of grief. I'm not going to go into kind of every single one, but I just wanted you to be able to note that it's just not that simple. It's not just being sad. And like I noted up here, there's all these different words that we use a lot. Mourning is the outward expression of grief. So just because someone's not showing you how devastated they are doesn't mean they aren't feeling devastated. And bereavement is specifically the period of grieving following a death. So if you get bereavement time, at your job or something, that is kind of more specific. But again, there's lots of things that you can grieve that are not about somebody dying. I'm just going to pause for a second. Does that make sense to everybody? Okay, just checking. So Ainsley is going to lead everybody through a short activity that we're going to do about grief.
Thank you, Joanna. Thank you everyone so much. Thank you everyone so much for joining us tonight. In your folders, you'll find.
We cannot hear. You can use
In your fold. Thank you. In your folders, you'll find a little piece of paper. It has a whale kind of that in it, and an envelope as well. I'd like to take the opportunity to invite you all to perhaps write a letter to a loved one you may have lost, or not a death-related loss. Perhaps, I'll use the example of an unexpected life change. Perhaps an individual played a sport in college and hurt themselves and could no longer play, and that sort of, our navigational system, our life navigation system,
redirected us unexpectedly. I invite you now to take a moment and write to a loved one or write to the individual you were before this life change, perhaps letting them know how you're doing nowadays, how things are going, and if you feel comfortable addressing the envelope to the loved one or to yourself or to whatever feels right. And if this is not a comfortable exercise for you, please don't engage. Oh, I also just wanted to add, these are for you to keep. We're not going to read them, and we'll give you some time. We're thinking maybe about 1 more minute. Well, thank you so much for allowing me to share this exercise with you. I hope it brought some comfort, perhaps, to a loss you may have experienced, and perhaps this is an exercise that you'd like to practice at other points in time. I would also like to say that the index card is for questions. If you have any questions along the way, they can be placed in that box towards the end. Thank you.
If you do have any questions, we're going to pause for questions in a few minutes. If you want to write down a question on the index card, if you write your email address on the bottom, one of us will respond to you by next week. And so if there's anything you want to talk about, or you're just not even sure how to ask it, how to describe it, or you would just like some further support, please feel free to write that on your little card, and somebody will get back to you very quickly if you don't want to share with the class. Can I just get a show of hands for anybody who just did that activity? Was that okay to do? Did it feel hard or weird or uncomfortable to anybody? You can just think about it. So that's like an example of what we would use as an intervention. That's something you can do one-on-one with somebody. You could do in a small group. You could do in a school. You could have kids draw a picture to their pet who passed away. You could have, you could write a note to yourself before you found out that you were losing your job and write about what you thought the future was going to be. Or you could write about how before this scary thing happened, I thought this, and now, look, I made it. I made it to the other side. I'm still okay. So these are just an example of something, again, so you can feel what it's like to have a trauma-informed kind of approach provided to you as well. But that is a kind of easy activity to incorporate into school, work, home, whatever it is. Okay, so we're going to talk about symptoms. So I usually like to refer to this as signs or signals. Symptoms sounds so sick. It sounds very medical. So we are trying to move away from such a medical perspective in mental health care. So I use words like symptoms, words like client, because it's what people know. But just so you're aware, part of being not only trauma-informed, but kind of people-informed and person-centered is to use more holistic and kind of kind, respectful language. So just so you know, that's why I often will kind of mix up the terms that I'm using for these things. But first, we're going to think about ourselves as adults. Again, you can raise your hand or think about it. Have you ever felt sad? Probably. I mean, I have for sure. Right? Like, okay, not shocking. Have you ever had a headache or a stomach ache? Do you ever remember feeling so nervous you felt like you were going to throw up? Like, these are all signals that we have experienced, our body giving us, because something is happening and we don't know how to deal with it. Most of these things are pretty easy to kind of understand or relate to, even if you haven't had that exact experience. So somebody might have tightness in their chest if they start to have a panic attack. Now, I haven't had a panic attack, so I haven't felt that particular symptom, but I can totally understand that if someone came to me saying that's how they were feeling, it makes sense. I get why you'd feel that way. Anxiety, worry, the unknown, that's a big one, can leave us feeling all of these things. And so can trauma, grief, things really that we're just not expecting to have happen to us. Sometimes just like the suddenness or the shock of something sends us into a lot of these symptoms. So you may have one from every category. You may have all from one category, you may have none of something. Any combination is totally normal. And again, I use the word normal loosely, because what even is normal? But it's totally okay to have all of these or none of these, some combination, some of them right now, some of them later. But for the most part, I think as adults, we're able to identify, like if you're feeling more on edge than usual, and someone says to you, God, like you're very irritable today, like chill out. You might be able to think, oh, whoa, I am. I'm like really angsty today. I'm really angry. Or like, I didn't mean to yell. I don't know why I'm so upset. You didn't even do anything wrong. But we can usually kind of look at ourselves and recognize when these things are happening, especially if somebody points it out to us, which frequently happens when we're being kind of obnoxious. You may be able to recognize, kind of these emotional states. Some are harder to kind of recognize in the moment. So you may not realize after a loss happens, you may not realize guilt for what it is, or you may not know why you suddenly feel kind of that like uneasy or queasy feeling inside, like something's just not quite right. And a lot of times it helps to just have the words to explain. Again, as adults, it's much easier for us to come to that conclusion because we have a whole lifetime of context to inform us. So we grew up. We had the experience of having lots of things happen. We had the experience of a stomach ache. So then when it happens again, we can name it for what it is. Guess who doesn't have that? Everybody else who's younger than us. So kids don't have that. They don't have the context to name or label and identify what these experiences are. Now, some kids do, because maybe they always get a stomach ache before the first day of school. Or maybe they always get a headache on Halloween because they're too excited and they can't take it. That was me. I would make myself throw up every Halloween because I was so excited, I just couldn't stand it. And then I would miss out on Halloween. So it just ruined it. But I couldn't understand why I was always sick on Halloween. I thought, what a weird coincidence that is. So one of the key differences to note with kids versus adults, not that the symptoms or signs are necessarily so different, but that kids are not able to connect something that happens to them with a physical manifestation or a sensation in their bodies. And their behavior tells us everything. So they're not going to say, oh, well, gosh, my tummy hurts today. What am I going to do? I'm very anxious. They're going to start crying, or they're going to say, I don't want to go to school, or I don't want to do that, or I'm so, like, I don't want to go anywhere. I'm going to stay in my bed all day. I'm never leaving the house ever again. And do they really mean that literally? Almost never. What they're trying to say is, something feels wrong, and I don't know what it is, and that's really scary. And I need you to help me figure out what's wrong inside me and make it feel better. So, again, this can be applied to many different situations, not only trauma and grief, but this is what we're kind of honing in on tonight. But there can be other circumstances in which your kid is having these symptoms. So if your kid says they have a stomach ache, it doesn't mean they're traumatized. These are broad categories. So the emotional component is really similar to being a grown-up. But our kids might not be able to say they feel guilty. That's a really kind of complex experience to identify. And if they don't have the context to know what that even means, they're just going to feel bad about themselves, or they're going to feel just dysregulated and uncertain, and again, that kind of like something's not quite right feeling. But it's much harder for them to name it. So as adults, either if you have children, if you work with children, if you've ever seen a child in your whole life, then these are the things that we're looking for as observers. If you've ever cared for a child, we're looking for changes in behavior. That's really kind of the key to all of this. Children's brains and bodies are not equipped to handle high levels of stress. Not like that we are either, but even less so for kids. Their brains and their nervous systems are still very much under construction, which makes them very vulnerable to extremes, extreme highs and extreme lows. The most important thing that we can do as caregivers, parents, grandparents, teachers, nurses, whatever it is following a traumatic experience or a loss, if you suspect even that your child was exposed to something very overwhelming, is to watch them, observe their behavior. The first and most reliable sign that a child or teen, and when I say child, I mean anybody under 21, that they're struggling psychologically is a behavioral change. It's kind of like when a kid is sick. You can usually tell how sick they are by how they're acting. If any of you have children, or again, have ever seen a child, you may have seen this or had this experience where, your kid is like, oh, I don't feel well, and then 20 minutes later, they're like running around outside. You're like, well, how sick could you really be? But if they are normally super high energy, and suddenly you can't wake them up in the morning, they have a fever, and they haven't eaten or drank anything in a day, they're much sicker than if they sneeze and then go run around outside. So based on whether or not they're kind of being themselves, you can gauge a lot kind of severity for sickness or anything else that's happening internally. For the most part, our kids can't help but just be who they are. Kids usually continue to act like themselves. That's a good sign. If our kids are just being kids, for the most part, it means they have not been completely overwhelmed by whatever it is that's going on. This could be a sickness too. They're not overwhelmed by a bacterial infection if they're acting totally fine. They may still have some symptoms, they may still have really big feelings or become very suddenly upset or suddenly angry or suddenly start crying out of nowhere. But it's the kids who begin acting like somebody else that we really want to get immediate support for, because that means that their system is so overloaded, they're showing you that they cannot handle what's happening inside for them. Now, for the kind of emotional category, it's important to remember that kids don't express their feelings the same way that adults do. So again, the way they're not going to say, I feel anxious, I feel very worried today. Maybe some kids do. I would be surprised. So they're not going to experience and then express things the way we are. We have, again, all this context to inform how we talk about things or who we go to when we're upset. When a child has experienced a trauma or a loss and might be grieving, it might be that the adults don't even recognize that their behavior is connected to that. Their behavior may be their way of expressing feelings of trauma and grief. In my experience, sadness, anger, and guilt are the emotions that are kind of leading the way and are the easiest to observe. So it's easy to see if a kid gets angry. That's a very observable phenomenon. But there are many others that are much more subtle, like a feeling of relief. There could absolutely be a circumstance in which someone, maybe you have an elderly family member who's been sick for a really long time, and then when they pass away, you have this sudden feeling of oh, it's finally over. Like, they're not suffering anymore. We're not endlessly caring for them anymore. We don't have to figure out who's going to stay at the hospital overnight tonight. And you may feel really guilty that you feel relieved. For a kid, it may feel like, oh, my parents are back now. Like, now they're home. They're not worried all the time. They're not sad all the time. They may feel really relieved. That's not easy necessarily to see happen, though. So they may still be having these kind of subtle reactive emotions, and their experience is still kind of happening within them, just like it's still happening for you, even if you're not showing everything that you're feeling. But they might not have the words to explain the experience of that kind of sensation inside. So you may notice just a general shift in a child or a teen's mood. They may just be kind of irritable all the time, or quick to anger, or the opposite. They may not react at all. Or you might think, why aren't you sad? You know, this like thing happened, and they're just being normal. You're like, but you should be sad. A sad thing happened. And instead, though, their way of coping is not feeling that. You know, they're protecting themselves by not having that happen. So any kind of big shift in behavior is always going to be the first kind of easiest thing to see happening. So if you notice a child, again, any child, suddenly acting very unlike themselves, that is a very big red flag. And doesn't mean that they are traumatized, but it means something happened, and that kid doesn't know what to do with it. They need someone to help them move through that experience and figure out how to name it, how to explain it, and then how to make sense of it all. Making meaning of this experience is kind of what the professionals are here to do. Now, in this kind of physical category, headaches and stomach aches, or like mystery aches, are very common. These are important to be aware of because the child doesn't always know that the reason they're in pain or like uncomfortable is because of this other thing that happened. So they might say that, you know, their knee hurts. And you're like, what'd you do to your knee? I don't know. I'm like, okay, well, like, is it broken? Like, what do you want me to do? Band-Aid? I don't know. But it could be that, like, because their dog died a week ago, they just don't know how to manage this internal sensation. And so that's a thing that they can identify. They can point it to that and be like, this is painful. And you might be like, but you're fine. You did not fall. You didn't bump into anything. Nobody tackled you today. But that's not the point. Their body and their kind of, you know, way of identifying things, they're just showing you that something is wrong. Again, it doesn't mean like every time your kid has an ache that they've been traumatized or somebody died. But these are like shifts. If it's a big change or it comes out of nowhere, it's not always related to then that kind of actual real physical thing that we're looking at. So if you have a kid who just has like general pain, they're like unsettled feeling, getting them to talk about what's different, what's been going on, you know, is a kind of better way in than being like, well, what did you bump into today? Did you fall down? Did your brother hurt you? Who did that to you? Because that's not always the point. So we're going to give them some language. That's kind of what I'm trying to get at here. And now all this is true for any of these categories, that we're looking for changes in behavior. So again, it's not like if you have one of these things, it's the end of the world. These are kind of, you know, some of these are universal experiences. Lots of kids get nervous or anxious about things. But even like kind of a low-level reaction to something, like your kid having a stomachache on the first day of school, or you having like butterflies before a job interview, it's important to note because it's just telling us something. It's information about us, our bodies, our experience. And if you don't have the words to name like the psychological and kind of cognitive experience you're having, your body is going to show you. So it's just good to note when those things happen so you can also give other people in your life the language to explain this. So like if you're really nervous, you could say, wow, I kind of feel like I'm going to throw up because I'm so nervous. And that suddenly tells an 8-year-old that that's what that means, and that's the connection between their physical sensation and something in their mind that's happening. So it's good to note for ourselves, and then we're always modeling for other people how to kind of handle these things in a positive, adaptive way so that they're not actually like throwing up every time something nervous happens. And please note that this is not meant to include every possible reaction or symptom or sign or signal. So you could absolutely see something totally out of left field, and if it's totally out of left field, it's a red flag. It means something is happening. And it doesn't always mean something bad is happening, but something is different. And the other thing is if you observe a lot of change over time, or if the behavior becomes dangerous in some way, call me. We want to look for things like suddenly being very risk-seeking, suddenly jumping off of really high things or climbing really high, or being really interested in how to like unlock complicated locks, or stealing your car all of a sudden, and your kid is like the best behaved kid in the world. Things that seem like wildly out of character, and as if the risk kind of factor increases, you want to find professional help, because that usually signals a kid or teen or even an adult saying, I'm going to keep escalating, I'm going to keep moving up the ladder of behavior until someone stops me. I can't stop myself, I need you to help me stop. And so you don't want to let it get to the point of actual, being in danger, but especially young kids, they will keep kind of going up this intensity level until somebody contains them, because they don't know how to contain it themselves. So again, we're just watching for changes in behavior, but if you ever see anything dangerous, like don't wait, don't keep watching, get help right away. Okay, any questions so far? That was kind of like heavy, it's a lot of information, and it's very kind of symptom heavy.
We can give you a moment to think of,
Yeah,
questions.
if you want to write them down, or you want to take a moment to let it all sink in a little bit, I just want to give you a breather in between these kind of very intense topics. I'm going to give you like 30 seconds and just think about it. If you have no questions, that's okay too. No pressure. Yes?
I came here tonight, I want to say what happened to town of Bedford and a student. Everybody should know.
Mm-hmm.
So I like to talk.
Thank you. I would agree. I think that everyone in the world should be well versed and well educated on how to experience their emotions healthily and how to manage these kind of big experiences. Because it's happening everywhere, all over the world. I mean, I live one town over, and I think it is so important that our communities are just well versed in what it means to have things happen to you and then what to do afterwards. A lot of us don't know, because you don't know, and so I always say it's not a problem until it's a problem. You don't even know to look for the help until you already have the problem. And so it's much easier to cope if you know ahead of time how to manage low-level stressors, or you know how you deal with stress or scary things before it gets to kind of this like elevated, intense point. So thank you for saying that. All right, 5 more seconds, just, we can all breathe, it's all good. We're gonna try and stay regulated, keep our blood pressure down. Is there anything else you want to say?
Having these conversations is very difficult with children, with adolescents, and even among adults. So I'm, it's so valuable to have this. So thank you, Joanna, and I'm so appreciative.
She's appreciative that we're having this talk. So trauma-informed care. I'm not going to go kind of like deeply into this. The kind of key principle here that I want you all to be aware of is that being treated with kindness and respect and an awareness that you may have a complex story happening in your life that we know nothing about. Everyone deserves to be treated with that level of respect in their care. So when we talk about being trauma-informed, again, this is a term sometimes kind of tossed around, or someone may say they're like trauma-sensitive. That's like not really a thing. But we want you to know that anyone, like a doctor, a nurse, that means having like good bedside manner. It means saying what they're gonna do to you before they do it, so you're not shocked by someone like grabbing your body. It means, a firefighter or a police officer addressing you by name if possible, talking to you before something happens, using like a calm tone of voice, because not everyone has to be screaming and panicked all the time. And for teachers, it means, assuming someone in the school has a really hard life, and therefore we're gonna treat everyone as though that's possible, so that we're not doing any harm. We're not overloading someone with experiences that they can't handle, or talking about topics that they cannot manage, and then being mad at them when they call out in class. So everyone deserves, though, that level of care and respect. And so I want you to know that you all deserve that as well, which is why I put this kind of little list of people who could do this on here. And that's why, at the very beginning, I wanted to point out, I put our little agenda up. It doesn't matter if you memorize it. It doesn't matter if you really took it all in. The point is, I am assuming that at least one person had a hard day. Maybe all of you had a hard day. I don't know. Maybe nobody did. But it's better to assume and treat people with a little extra kindness, because everybody can benefit from that. And again, I'm not going to go deeply into this. There's a whole model of care around trauma-informed care. Again, it's really just creating a sense of safety, so saying what you're going to do to someone before you do it, being transparent, not lying. Like when you come to therapy, I'm not going to be like, ooh, I'm going to read your mind and then fix your brain. Like that makes no sense. But it used to be that people thought psychiatrists and psychologists were like mystical people who could like read your thoughts. That is for sure not the case, I can promise you that. And so being transparent about like what is the service you're getting, what is the care you're getting, what is your treatment, what's happening to you, why are we even doing this? It's all just like, I think it's just pure like human decency, but there is this kind of official model that we call trauma-informed care. So again, you don't have to like remember any of this, but you all deserve this, and so if people do not treat you kindly, you are entitled to speak up, I believe. So now we're going to talk about intensity. So I like to call this the emotional roller coaster. I talk about this a lot with kids and families, but I often say to people, you have to just like ride the ride. In my own home, I have 3 kids. I often tell them that it's like they fall off a cliff, because that's what it feels like to me. You get to a certain point on your like intensity ride here, where it's usually between agitation and like just above that agitation word. This curve, by the way, is just random. Like not everybody feels this particular level of intensity. But you get to a certain point where you can't tolerate whatever it is you're feeling anymore. So it could be someone's just annoying you. Like annoying things happen, and then you're stuck in traffic, and then something else happens, then your car breaks down. You reach a limit at which you just cannot calmly take it anymore. And that's when you kind of quickly accelerate and go to the peak. So you go up this emotional intensity hill, if you will. You can't be like, oh, I'm just gonna calm down now. Like, has being told to calm down ever calmed anyone down? I'm pretty sure not. In fact, it probably makes it worse. So we reach a point where maybe like one thing happens and you're like, okay, that was tough, but like I can recover, I can move on, I'm okay. Maybe like your car breaks down, but you already know you don't have any meetings until 2 o'clock in the afternoon. You're like, I've got time, I can deal with it, I'm gonna move on with my day. It's gonna be okay. But when you get past your ability to just tolerate it, to just take it, calming down is really no longer an option. You have to kind of let the emotion, let the experience ride out. You have to finish this ride. So the peak can look like different things for everybody. It could be bursting into tears, and then you feel so much better after you like have that emotional release. It could be that that's the time when somebody walks in and you snap at them because it was like the straw that broke the camel's back, whatever. But afterward you're like, oh, I'm sorry, like that wasn't you, I've had a hard day. We all go through this constantly. The key is that we all have different tolerance levels. So someone who's incredibly centered and like meditates every day and is like the chillest person in the world, maybe they can tolerate a lot of chaos before they snap, like all the chaos. That is not my level. I know when my kids are making me nuts, if I'm approaching kind of my window of tolerance, if I'm gonna close the window, I know I'm like gonna get upset. And I'll be like, hey, like I need to walk away now. I know I'm reaching my tolerance limit. It's not because you did something wrong per se. I've had this buildup. That's a me problem, not a you problem. My problem is that I'm reaching my limit and I have to deal with that. So again, this is different for everybody, but it's important to note, again, because kids don't have this language, there is a point at which they cannot just calm down. Neither can we. So it makes sense that they can't either. So if you see someone, anyone, kind of going up in terms of their level of intensity of emotion, now it's not always like anger, that again is one of the kind of most obvious that you can see, or sadness, somebody might burst into tears. There aren't always these really obvious signs though. But when things kind of keep happening that might be distressing in some way, everyone's gonna reach kind of the end of their rope at some point. And so then it's not shocking when they are even more upset the next day or when the next thing happens. And you can't just like undo all of that experience. Part of it is that your nervous system is activated, you have cortisol, like stress hormones flowing through your body. There's a lot of things happening internally that you cannot undo. Similar to like if you get like an adrenaline rush because something scary happens or exciting, or you're like playing a game and you're gonna win, or whatever it is that gives you this kind of flooding feeling. You can't like undo that. You have to let it ride out and kind of finish the experience. So it's important to note that if someone around you, it can be an adult at any age, any person of any age, if you observe it though, you can't just tell them to stop. There is no stopping at a certain point. But being there with them and letting them just move through it and letting them know it's okay to have the experience. It's okay to be that upset. It's not okay to like hit me because you're upset, but feeling the upset is okay. And I'll still be here, you know, kind of when you're ready to come down. So just knowing that this is like kind of this internal process happening, I think this is helpful to visualize. Again, I often tell kids it's like being on a roller coaster. You can't just stop at the top. You're gonna be at the top forever then. If you distract someone or like kind of try and pause them, you're pausing them where they are. You're not undoing what happened to them. This is kind of a side note, but this is a reason that oftentimes it's really discouraged to use screens to distract little kids, because you interrupt the experience, but you don't undo any of it. So then if you like give a kid your iPad because they're screaming and crying, it doesn't undo whatever made them upset. You pause it. And then you take it away, they're gonna scream and cry again because they're still upset. So letting people experience their own emotions is really important. So now we're gonna talk a little bit about having these hard conversations. And the reason that I started with this kind of emotion intensity piece of it, one slide back, is because having these conversations can be very emotionally intense for us as adults. So it's also important to be able to take stock of kind of where you are and what your experience is, and kind of if things that like feel like they're ramping up that level of intensity, or things that you know are calming and are gonna make you feel better. So if you're starting to get amped up, but you know that after whatever's happening, you get to like go home and relax, it's easier to kind of tolerate whatever's happening knowing you have something on the other side. But again, kids don't have this experience. So we're gonna go through kind of different ages. So if you don't have a 3 to 6 year old, don't worry, that's okay. And for the most part, the general principles of kind of how to talk to kids are very, very similar across all ages. I often jokingly say I have this theory that we should treat everybody like a toddler. And I say that in jest because you shouldn't like talk to them like they're 2. But at the same time, if my 2-year-old, well, he's almost 4, is not cooperating, did I even tell him what I wanted him to do? Was I clear about my instructions? Is what I want even possible for him to do? I have to kind of check myself. And we really should give each other the same consideration. So if I'm asking Ainsley to do something and she's not doing it, I'm not gonna scream in her face about it, but I might need to stop and be like, did she even understand what I meant? Was I clear? Did I even explain? Or did I just assume that she knew what I wanted because she's an adult and I just assume everyone knows what I know, which is a common experience. We often just assume people have the same kind of general contextual understanding that we do. And it's almost never true because no one lives your life except you. So if you talk to everyone with kind of this general idea of being aware of your own feelings, staying calm, not punishing people for having feelings, that's a great place to start no matter how old somebody is. Do you want to say something? Yeah.
I'd like to say that it's okay to, share and express and have your feelings while you're also helping others process, as Joanna's really breaking down for us. It's, all about how are you doing in the moment, and are you ready to have these talks with your loved ones, your children of between the ages of 3 and 6.
Yes, and I kind of, these age ranges are somewhat arbitrary because it depends on the person. These are very general guidelines. You can, modify anything and apply it to anybody in your life. So this is not like a strict boundary. At the top, it says prepare. This is the same on every slide that I'm gonna do. I just want everyone to kind of be aware. This is a good principle in general. There's a book called How to Have Difficult Conversations that I recommend everybody in the entire world read. It is fabulous. But it really just breaks down some of these ideas. And kind of the key is this conversation appropriate, necessary? Is right now the right time? Sometimes it's really not. And you need to be aware of, like, if your kid or your spouse or partner comes home from work and they had the worst day of their life or they got fired, is that the time to tell them that you're leaving them? I mean, maybe not. Being aware of the kind of who, what, where, when, how is really important, and being aware of, especially with children, again, because they don't have a lot of this just life experience, but being aware of, like, where are you going to talk about this? Are you going to talk about it with your whole family, alone in their bedroom, right before bedtime? Well, I'm not going to talk about like a school shooting with my 9-year-old when he's in bed going to sleep, because I'm pretty sure he's going to have nightmares. So like that's setting myself and him up for failure. But I'm also not going to talk about it like in the car with his 3 best friends, because that's not a productive time either. So being aware of kind of what is happening in the moment. Now, I'm using very, very general terms here. Again, a lot of this can be applied to anybody, anywhere, anytime, any hard situation. If anyone has any specifics they'd like, some guidance on, Ainsley and I are also happy to provide specific examples. I tried to give as specific as I could without actually being specific.
If you'd like us to, act something out, we can.
Oh my God, no, we're not acting it out. Yes, if you'd like a role play demonstration, we can do that too. So,
Role play.
So my kind of key thing that, again, I would like you to take away is it's really important to wait until whoever is involved is calm. You don't want to start out already like high on that roller coaster because you already know it's only going to get worse. So you're setting yourself up for like some sort of emotional explosion, some sort of behavior that you maybe don't want to see. It's not like you have to wait until the person is happy per se, but until they are not already upset. So there is a difference. You don't have to like be happy all the time, but not being happy doesn't mean you're furious and devastated or angry or exploding. You can be at kind of like a neutral state where you're just contentedly existing. And again, you don't always have a choice. So I just want to caveat this with, if you just have to, you just have to and you'll deal with it. But the key here is that like as an adult, you have to be ready and willing. You're signing up to deal with the consequences of your actions, and that's not a bad thing. But so if you know that having a talk about something scary, say a dog dies and you're going to tell your children, you have to know there's going to be a reaction and you have to be okay tolerating that reaction. Like that's our job as adults. Our kids don't know how to manage these experiences. And so, we can't be mad that they have a response to something that we just put on them. So if you're going to talk to somebody who's already upset, just knowing that's fine if you need to, but you need to be able to tolerate whatever comes back to you. So again, this is with young children in mind. I'm not going to read every single one of these to you guys, but the key is being aware of yourself and what this conversation is going to do to you. So if we're talking about kind of world scale things, if there's a war, who would ever imagine going on? And you're going to talk to your kids because maybe they heard about it at school. Maybe your kid comes home and says, like, what are guns? You're like, okay, well, now I have to address this. I have to explain. I have to give context because I don't want them to hear it from a 5-year-old on the playground, or I don't want them to get like misinformation through someone's brother's, cousin's, aunt's, uncle's niece. You want to give them facts. You want to be truthful in an age-appropriate way. That is also something that you may hear a lot, the term like use developmentally appropriate language. I'm going to tell you what that means. Don't worry. The other kind of key here is to tell them the truth. Doesn't mean that you give them gory details, but don't be like, oh, well, that was just pretend, a story in a book, like that didn't really happen, because that is patently untrue for most things. So you want to give them whatever, like the least amount of detail it takes to answer a question or kind of like satiate their curiosity or correct misinformation. The other thing is you really want to be open and make it clear that you're open to answering their questions whenever they're ready. It's not like this is a one and done deal. This is not like an invite only party. You are having an open-ended invitation expressed. So if your kid is freaked out about something and you want to explain and you go through and they seem okay, it doesn't mean that's over. It just means it's over for right now. Maybe you're pausing the situation, the conversation, whatever it is. So making it very clear, though, explicitly. Again, not assuming people know what you know. So saying, if you ever have any questions about this, let me know. And if I don't have an answer, I'll find out, or like we'll find out together. But I'm always here to answer your questions or to talk about this if there's something you want to say, or just kind of like get off your chest. So these are things that we have to like say out loud. It's not enough to just assume someone knows. Like you might think your children know you're always there. They don't know until you tell them. You can't just assume. So those are kind of key takeaways. Again, I'm not going to read every single one to you, but the other kind of big don't is don't overload them with details they don't need. So a 3-year-old doesn't need to know all the details of a school shooting, but they might be scared that something happened. And that's enough to be scary for them. But you only have to kind of combat that with enough information to reduce their distress. You don't have to go into like a lot of detail about the situation. And the other kind of big thing is don't let your child or anybody worry alone. We say that in our clinical work as well. You should never be anxious and worried about something by yourself. You should share the burden of that worry because it's usually much easier to manage and problem solve and deal with the support of others. Like I said at the beginning, kind of deep connections can get you through almost anything. It's really important to any kind of healing and progress and kind of managing giant life events is having a sense of community and connection. So your child, though, might not know to ask for that. They might not seek you out because they're upset. They want to kind of hide, maybe literally under their bed. But letting them know that your presence is there as well, when they're ready, they can come to you, is really important. Any questions about talking to little kids, just in case there's any specifics? Okay, so now older kids. Now, a lot of this is really similar because the language you use is different, but the tone is not. We're trying to still create this sense of safety, a sense of, I can take it. Whatever you're upset about or whatever you're feeling is fine, and I can handle it. Now, I just also want to be clear, when we say, like, feel your feelings, all feelings are okay, all behaviors are not okay. Feeling your feelings is cool. Everybody should do that. It doesn't mean you have to do whatever you want because you have a feeling. So those are different things, and you can also say that out loud to your kids, or to anybody, really. And I would say this even to an adult. Like, just because you're really upset doesn't mean you get to treat me badly. It's okay that you're upset. It's not okay that you punch the wall. It's not okay that you come to my office and scream at me. Like, being upset is one thing. Behaving is a different thing. So again, a lot of this is the same, being aware of yourself, preparing yourself. I also have this little box at the top. If your child's behavior ever seems risky, or it seems like they're having something happening kind of internally that they I don't even know how to say it exactly. It feels like they're gonna
Grappling with, wrestling with.
yes,
maybe
kind of intensely. If they really can't explain, it's a great time to send them to therapy. Because we have a lot of the language that kids just don't have. But if they really seem like, again, like they're kind of escalating this intensity, and if it ever seems that their incorrect thinking could lead them to dangerous behavior, like if they wrongly think that something is happening in their town that is actually happening in a different country, but they want to go find the bad guy, that's not a good place to be. So if they ever feels like their kind of understanding of things would put them at risk, it's good to intervene immediately. We don't always want to just wait and watch. For the most part, we do. Kids are usually okay if they have support and conversation and information. But it's good to just know kind of where the line is. Whenever that kind of risk level goes up, it's time to intervene. Again, so older kids, one good thing to note, all kids, they don't think of things in the same terms and context as us. So again, I'll use the example of a pet dying. So if your family pet dies and you're thinking, oh my God, I bet they're so afraid that I'm gonna die next. Or I bet they're so afraid that they're gonna go to sleep and never wake up because the dog went to sleep and didn't wake up. They might have no awareness of that at all. We can't assume that anyone thinks the way we think, is scared of the things we're scared of, or has the same worries that we worry about. So kids may be scared of something completely different and unrelated. It may feel totally disconnected. But if you say something like, well, it's okay, you don't have to worry, I'm not gonna die next. They'd be like, oh my God, what do you mean? You are gonna die next? So just being aware that no one thinks the way you think except you. Kids are not assuming the same things we're assuming because they have none of that previous experience to inform their thinking. So I wrote up there, don't mistake your fears for your children's. This is something just that I see so commonly. And even as a parent, I have to remind myself, they don't even know that thing exists. They're not worried about it. I'm worried because I know it's possible. They don't even know that's an option. So they're not worried about things they don't know about. They're worried about their friend on the playground not liking them tomorrow. That's completely different, than my concerns and my worries. So just not assuming that they're so worried or anxious or scared or preoccupied with something that you are, it could be so unrelated, or it could be so kind of low level compared to the things that you're feeling anxious about. Also, don't use a lot of euphemisms and metaphors. It's important that kids have actual language to explain actual events. Again, you don't have to give them a lot of details, but trying to really smooth it all over saves no one. It really puts our kids at a disadvantage then, because it's very protective to have factual terms and kind of definitions of what's happening to them especially. But in the world, again, you don't have to tell them what a machine gun is, but they need to know what a gun is. Calling it a blaster is not going to save them from ever being told what a gun is. And so using kind of gentle, soft words, it might feel like it's protecting them or shielding them in the moment, but it really does a disservice in the long run. And again, this is also true for adults, for anyone that you're talking to. Sugarcoating it too much really doesn't help anyone. It's usually a harder blow than when you kind of find out the harsher truth or kind of like the real reality of something. Yeah, please.
Yeah, I would just like to add on to Joanna's point. Coded language and those softer terms can sometimes do more harm than good when working with children and adolescents and we're debriefing about trauma. Those coded phrases or it breaks. It's hard to get to the root of
Right,
things.
so it can be hard for a kid to explain what happens to them if they don't even have the real words to explain what happened to them.
Thank you.
I got you.
Yeah.
No worries. Just as, again, kind of an aside, like it's having the correct anatomical terminology for your body parts is a very highly correlated preventative measure against sexual abuse. Kids are more likely to be sexually abused if they do not have the terms to explain the parts of their bodies. Like there's a lot of research on this. So that's just one example, but it's really important that kids have like actual words and terms for what's going on. And it's not just kind of arbitrary that we like want them to go around sounding like little doctors or dictionaries. Mm-hmm. It's very helpful kind of in the real world and when scary things do happen, because they do. Any questions about this age range or these kind of conversations? And it's a little, it can be uncomfortable to hear this, especially if you ever have experienced young children, because it doesn't feel like the kind of thing you want to talk to them about. Yeah.
I have a question. When my kids, I have two daughters, when they were younger, I used the anatomically correct stuff, and I still do, and they know now that they're in college.
Mm-hmm.
But at that point, they came up with their own words.
Right, it's okay if they use those, as long as they also know, like if somebody said, well, what does that mean? And they have the word for what it means,
Yes.
you know,
Yeah, they had
yeah.
the word, but then they came up with
Yeah, but kids get like embarrassed or they get silly,
what they
yeah.
came up with.
Yeah, it's just about knowing the words, right? So it's like if they don't know this is an arm, they call it a blob, and then they broke their blob. Like nobody knows what they mean. You know, like so it's just about having the language to explain what happens to you. Does that make sense?
Yeah.
Okay. That was a great one. Okay, so now adolescents. To me, adolescents could be the scariest people on the planet to talk to. So I can understand not wanting to have a very emotionally intense conversation with a moody, hormonal, angsty teenager. But they're the ones that need it the most out of almost anyone. Going through puberty and being an adolescent is really similar to being a toddler in a lot of ways. You're going through this massive brain growth. Their brains are doing something called synaptic pruning. They're honing in on their skill sets. They're learning new, much more complex ways of thinking about things. And their bodies and brains are doing a lot of heavy lifting at this point, which makes adolescents, number one, vulnerable, because their brains are doing so much work. Their brains are not also attending to lots of little details on the outside. Their brains are busy doing like very intense work, and their bodies are growing a lot. They often have growth spurts, and their hormones are crazy. So there's a lot happening physiologically that is occupying all of their like energy and strength. And number two, they're just moody. So they're not like that fun to talk to always. That's okay. Imagine talking to a 3-year-old. You're talking to an adolescent. So again, being aware of your own experience is really critical. And now when we get to this age range, and again, this is arbitrary, it can be an 11-year-old, a 12-year-old, a 25-year-old, whatever. But noting that it's really important to kind of encourage and ask about their experience of things. They don't really want to hear you lecture them, but they want to make sure that you understand they are a whole person and they are having an experience, whatever it is, good, bad, ugly, and they want to know that you care enough to notice. A lot of teens, have a hard time kind of asking for attention, and by that I mean they don't do that. They act out like a toddler would. But instead of punishing people for having feelings and expressing that, they want you to notice that they're having that experience. So checking in about what they know and what they think. How did it feel to learn that that happened? Was that really hard? I don't know, it was hard for me. I bet it was hard for you too. Or, what was it like when that happened? Really just asking about their world experience and not assuming that they want to be informed by us. Sometimes they do, but sometimes they really don't. Another kind of key important thing here that is true for everybody, but I think especially for teens, is always being available to talk again. Something that is really important kind of just in general is just building that sense of they can trust that you're not just a trustworthy person. They can trust that you are available for them. They trust that you will give them attention when they need it. And they can trust that you will be there should something happen. So again, saying these things out loud is really important because you can't assume just because your mom or dad or whoever that they just know they can always come to you. They want you to say it so that they know that you know that they know. And again, a lot of this is very similar to the other ones, but another thing that's kind of unique-ish to teens is that when something really scary happens, and again, this is like worldwide, in your town, community, anything that feels at all kind of personally connected to you, is maintaining your routine and maintaining boundaries. So because, say, in adolescence, parent passes away, they don't suddenly get a free pass to like the world. That's not helpful. It's helpful to feel safely enclosed in your boundaries, whatever that means. It doesn't mean that they can't do anything, but it doesn't mean that they suddenly need all this extra leeway because something happened to them. It feels much safer to know someone's got your back. It feels much safer to know that you know kind of like, where is the edge? How far can I go before I fall off the cliff? You don't want to be shocked by falling off the cliff. You want to know like where the railings are. And this is, again, true for everybody, but especially for teens who experience something really emotionally intense. They will push back. They will test you because they want to be sure, even when something scary happens, are you still going to protect me? Will you still love me even though this thing happened? Are you still there even though you're dealing with your own sadness or your own difficult emotions? Are you still there to protect me and keep me safe? And the answer should be yes. So that doesn't mean, now you have no curfew or now you can sleep over at somebody's house if you've never done those things before. It feels safe to have guardrails around your life. For the most part, we all feel better knowing where are the limits of my world. And so for teens, when they're really overwhelmed in other ways, that's when we really want to make them feel safe in this kind of concrete way. So you don't relax all the rules. It's not like everything has to change, but it can feel hard to keep the boundaries. Oftentimes it can feel weird. I remember when 9/11 happened, that I was at school, and I remember being confused that we still had to go to school the next day. But it makes total sense because you cannot stop your life every time something happens, especially in this day and age, which I hate to have to say. It doesn't mean we don't acknowledge it. We don't give some accommodation for sadness. We don't, having school counselors available, having therapy available to you, having your parents be available to you. But it's not helpful to just sit and stew in that intense feeling and sensation. So going back to kind of normal, having your routines in place, those are all really important, but especially at this age. Any questions about teenagers? Okay. Another phrase that you may hear is meet them where they are. That's something that we kind of say a lot. So that really means, though, figuring out where they are emotionally. So are they upset? Are they happy, calm, whatever. And also, what do they know? What do I not want to inform them of? But if they already know, what do I want to address? So meet them where they are doesn't mean you have to lay on the floor because you have a small child with you. But it means don't tell a 3-year-old something that is way over their head. But if they bring it to you and you're oh, I didn't know you'd ever heard of car accidents. I didn't know you'd ever heard of that thing. If a kid says what is diet food? And you're oh, I didn't know we were going to talk about that. What do you know? Where did you hear that? So assessing kind of what they're coming in with so you're not overloading them with new information that they don't need. But also you don't want to avoid the topic just because you're uncomfortable. So that's what that means, in case you hear that. Okay. So again, I'm not going to read through every single one of these. I have samples, and are these in the folders? No. Okay. So these are kind of conversation prompts almost. So I tried to break it down. So if somebody brings this conversation to you versus how you can explain things. Again, I try to be very general without being so general that it's useless. But kind of how to actually word things can feel really tricky. Because again, you might hear just use developmentally appropriate language and explain the war in Gaza. No big deal. It sounds almost impossible to do. So what it really means is breaking things down, again, not giving too much information, being curious about what they know, where they found out about it. And these are, again, kind of like open-ended questions that you can ask. Are there any questions or thoughts about this? Because this can be like the weirdest part to actually have to like do. And again, all this can be used with anybody, not just children. Okay.
I think it might be helpful if whoever attended this to send it out, because I know that I've had
Yeah.
these for, my kids when we've gone through stuff, so.
Yeah, we can definitely do that. We've been talking about different ways of making this information accessible, so it will be,
Yeah, we can.
we can,
email it out. Do people feel comfortable including their emails and perhaps leaving them in the box, and we could email the presentation?
there you go. If you'd like to have access to all of
Yeah.
this, you can put your email address on a little card, put it in the box. You don't have to have a question. You can also put a question, and I can send you everything.
Questions and emails.
Yeah, if you're registered, we have your email, so.
Oh, perfect.
Rest assured that we'll send it out to you.
There we go.
If you do not pre-register, then just make sure it gets on the card and gets in the box.
There. Thank you. Perfect. So I often call these like conversation starters. Some people like to have scripted language to be like, to literally use what's right in front of them. You can absolutely do that, but these are things you could always modify. So I just don't want you to feel like you have to read from a piece of paper if you're talking to your kids or anybody else. You make it work for yourself. I like to have prompts like this in mind. So if something is going on and I feel overwhelmed, I can be like, okay, I'm just gonna start with, okay, well, who told you that? And then kind of go from there. So it's sometimes helpful to have these as kind of prompts to just get yourself going, and then you can kind of adjust to the person you're talking to. And again, this can be for anybody. You can, if somebody comes into your office at work and is like all kind of in a tizzy, and you're trying to figure out like what is going on here, you can start with a simple open-ended question that just gives them an invitation to explain why they're doing what they're doing. Another thing that's good is to offer breaks. So saying, this is a lot. Why don't we take 5? I'm gonna go get some water. Why don't you go to the bathroom or get a snack, then we'll come back. You can always give yourself a break and give other people a break. It's never a bad thing to do. Again, these are all, again, very similar, just the language is a little bit different. So I can understand why it'd be helpful to have these for yourself. So we will send these out so you can actually read through them all, because I don't think we need to read every single question. But again, the language just changes slightly to include the child or adolescent or small child's experience. And so we're being curious about things that have happened to them and giving them a little bit of background, like the first one under explanation. This is something that I say a lot to my kids. Hurt people hurt people. That's something people kind of throw around all the time. So oftentimes, if something bad happens in the world, I try and reflect on, why do you think that was that person's only choice? Why do you think they felt like that was the only way they could get their point across, or they could, get a hold of someone, or they could make themselves known? It must have taken so much to get to that point. I wonder what happened to them to make them feel like they had no other choice anymore. So this is something that also builds a lot of empathy, because we don't want to just punish people for having their experience. It's important that we acknowledge people do not exist in a vacuum. Things happen to all of us to get us to where we are today. You guys are not here by accident. You didn't fall into this room. Things have happened that made you think it was a good idea to come, and I'm so glad you did. And my life experiences have led me to be wildly interested in trauma and, invest all of my time in this, and then be able to come and talk to all of you. So it's not just happening. Something else happened before, and before that, and before that. So even though we're talking about sometimes really scary stuff, it really humanizes everyone and helps you build empathy to acknowledge this did not come out of nowhere. Nothing that people do is just because they felt like being terrible that day. It's usually because something terrible already happened to them, for the most part. That is an oversimplified explanation, but just it helps with kids. So just acknowledging that, however we got to this point, yes, it might be really scary for us. Yes, it might be horrible for someone. And also, it can be true that something really terrible happened to the person who perpetrated that thing, whatever it is, or that country's leader, or whatever. None of that happens alone in isolation or without other influences. So it's really good to build empathy for other people's experiences, not excusing it, but acknowledging that was not their first choice. I bet they tried something else first. I bet they tried to talk. I bet they tried. I'm going to give them the benefit of the doubt and assume at least one time they tried to express themselves another way. And maybe nobody was listening. How sad might that be? It would be really terrible if no one listened, and then the only thing you could do was yell and scream and shout. None of that just happens by accident. Again, for adolescents, a lot of this is generally similar. The tone is very similar. But we're talking a little bit more about kind of the meta version. So we're getting a little more existential. You can talk a little bit more theoretically, so not quite so literal, like, today my dog got hit by a car. You can talk more about unsafe driving practices are really a big problem around here. If we had a better stop sign there, maybe this wouldn't have happened. You can give more context, go kind of bigger picture, but still, again, just being compassionate and empathetic is really important. Do you want to say something? I feel like you have. No? Okay. Any questions on this and kind of how to actually have a conversation? Okay. So now we're going to talk about calming down. This is, again, you don't have to memorize this. This is just to show you, again, kind of the idea of the roller coaster. It's cyclical. These things are kind of always happening, always feeding into each other. So something that is really helpful to anyone, but especially children, is naming your experience. So again, kids don't always have the language. Oftentimes adults don't have the language. If you are, so distressed that you then end up in the ER or some sort of crisis place, you might not even be able to explain what's happening. But once you can, it makes a lot more sense to you. Oftentimes we feel this way with diagnoses. It's not because we want a diagnosis of whatever, but it makes more sense to have that context and that framework to understand where we're going. Why is this happening? What is even happening? So having language to explain what's happening to us is really key, for adults as well. And being able to notice, again, the nervousness thing. Before I started tonight, I was oh my God, I bet I'm gonna be up there and sweating because I'm gonna be so nervous. Just noticing that something happens to you is the first step. And then accepting it, being okay, well, I'm nervous. That's okay, I'm allowed to be nervous. People are watching me, that's scary, maybe terrifying. It's fine, it's gonna be fine. Being curious, okay, well, if I'm really nervous, am I actually gonna throw up? Probably not. That would be bad. Am I feeling a little jittery? Maybe, it's okay. What else? Where is this going? Is it making me think of that time that I tripped on stage and fell in front of everyone, and that is actually what I'm thinking of? Because I'm not gonna do that now? Maybe. And then letting it go. Okay, well, it's okay that I'm nervous. And I'm still gonna do whatever I'm gonna do. I'm not gonna not do it. I'm gonna move forward, and it's okay. I'm not just going to do what my nervousness kind of tells me to do, which is maybe run. I'm not gonna only act from that feeling. It's okay that I have that, and I can keep going and move forward. Now, again, that's easy to do when it's something low level, like butterflies in your stomach. It's harder with bigger and more intense emotions, but it is possible. And so these are things we practice with kind of these lower level emotions. So if you're sad because something happens, going through this process just kind of in your head is helpful because then you can do it when you're much more stressed or there's something bigger that's happening to you.
So
Huh.
I have a question or kind of.
Yeah.
What is that?
Can you use the microphone?
Sorry, just because we're not recording. We're not gonna record you, but I want to record the question. Yeah, of course.
Right there, yep.
And I'll be cognizant of time because I know we only have 5 more minutes.
Yeah, we're almost done, don't worry. I don't know why this slide is all messed up. But is this one of the ones that's in the folder?
Dylan, can you hear me? Is that closer? Okay. So with the naming of emotions, I know with kids, it may just come up naturally, but some of the things that we did growing up, we were like, hey, let's play emotions bingo. And it feels really silly, but it's actually a really cool idea to help them identify it. And so it may be oh, when was a time that you felt silly? And it's just, or you could do it at the dinner table. But I was thinking about how we could, introduce those feelings to kids because there's some that
Absolutely.
they may not know what shocked looks like.
Yeah.
So
So actually, So one thing that I do a lot with kids that I work with is emotional charades, because I want to see like how do they think shocked looks? How do they interpret anger or sadness or whatever? There are lots of ways of doing it. So social emotional learning is definitely incorporated into our curriculums in schools. It's a lot of places now. It's not perfect, it's not everywhere. But that's part of why we also model this for kids, saying things like, okay, like I'm really nervous. I can tell because I'm sweaty and my stomach hurts. You know, and like giving that context. So the first thing you can do is model it, say things out loud that are happening for you. And like playing a game is always a great way to introduce things, because who doesn't love a good game? And then, you know, increasing training in our schools for social emotional learning. We'll do that next. Okay, so I don't know what happened here, but this is just an example of coping strategies for ourselves, but this, you'll all get this. And this one on the left that's kind of covered is a 5, 4, 3, 2, 1, which you may have heard of, maybe not. But that's a really common skill is not even like the word, like activity or thing to do.
Strategies.
Yes, people often do this. So it's like 5 things you can see, 4 things you can hear, and you go through it just to bring you back to the present moment in your body. So again, I'm not sure what happened here, but you'll get a cleaned up version of this. And these are just ideas. But the whole point of this is that if you are able to manage yourself, you can help somebody else. You want to share your calm, not join someone else's chaos. So regulating yourself and just knowing how to calm down, or like where to go if you need to kind of finish out that emotional ride. Like if you know you need a break, taking a break. I also don't know what happened here. Sorry, this got a little bit wacky. These are just ideas for co-regulating. So this is in your folders. Co-regulating means like sharing your calm, essentially, being with someone through their intense emotional experience and demonstrating how to kind of come out the other side. So these are just ideas. You don't have to do any one in particular. But once you feel calm and regulated, you can then pass that on to somebody. But you can't if you're a hot mess inside. So the things that are on the previous slide about calming yourself can also be taught to children, adults, your spouse, your parents. But if you're able to stay calm, you can pass on much more than if you are dysregulated and like discombobulated. Do you have something to say? I feel like you want to say something. Anything? You're good?
Oh, yeah, I totally agree with what you're saying. Like, you can't, it's almost like you can't.
Sorry, Michael.
Sorry. Like, you can't help someone if you're also experiencing, dysregulated emotions.
Yeah, there's that saying about like putting your own
Put
oxygen
yourself
mask on
first,
first, right? Like, right, you have to be a somewhat managed person. And that doesn't mean you're like totally fine. It just means you are in control of your own experience. You know what's happening for yourself and you're able to manage that. Again, doesn't mean like you're happy necessarily, but you can't be flipping out and punching walls and then expect you to calm someone else down. That will never work. So until you kind of either finish out your ride and just like relax yourself, or until you say, I know this is making me very upset, like, it's okay, I got this. It's okay that you're upset too, like, why don't we both take a break? You know, whatever the thing is you want to do. Just being able to manage your own emotions is shockingly difficult, and there are many, many adults who don't know how to do this, which I didn't know until recently. It can be surprising when you realize that someone in your life can't handle being upset well. They just don't even know what to do with it. So if you know what to do with it, you can much more easily pass that on and kind of share that and help someone else manage their experience. Now, these resources are also in your folder, and there's even a few more. I found bazillions of resources that are some local, some national, some international. Our information's on there. Ainsley, Joanna, if you need any like local services, we are not only available, but also helpful in guiding you through this process. If you feel like there's something you need and you don't even know like what you need, that's what we're here for.
We can help you do the searching.
Yeah,
We're
so
here.
we want to be able to support you all through either finding what you need, naming what you need, or providing what you need. So this is just for you guys to keep. The top ones are, crisis support. So Advocates Mobile Crisis Team it's almost like an ambulance, but for mental health. They will come and assess the situation. So like if you're in a situation where it just feels like something's getting out of hand and you don't know what to do, like those are people that you can call. Just like the Massachusetts Behavioral Helpline, They also, you can call or text, but they will help also like guide you through finding a resource if you don't know what you need. You can explain the situation to them, and they'll help you figure out who could help you. And then, we're not crisis management, but we'll also help you if you need help figuring out like where to go, what to do, or if you would like to look into, therapeutic services. We're happy to walk you through that process. And then there's just tons of information, and yours again has more. I put the websites in reds and say you can't click on them on your piece of paper, but I'm sorry you have to like actually type them into a website browser. But these have tons of information. There are like infographics, like here's what you say in this situation. Here's how to talk to teens about violence. Here's how to talk to kids about this. So there's lots of very like specific stuff in there, and I vetted all of it for you. So it's all good stuff. It's all very useful. And if you'd like any more information on that stuff, please feel free to email me, and I'm happy to send you any information that you need. Any questions? Okay, well then we're done. Good night. Thank you guys for having me. Thank you. Do you want to say anything else, Amy?
I just want to thank Joanna and Ainsley. A great presentation tonight. Again, if anybody has any questions, please feel free to write them down and leave them, and we'll get back. The team will get back to you, and we'll sort out the presentation and getting that all to you. And we'll actually try to make the links live, so you can just click on them and access them readily. And we're looking forward to having some additional future presentations with Edinburgh. They've been such a fantastic partner so far. But there's a lot of really interesting topics that we think that we can dive into here within our community. And so stay tuned for future announcements along that. So thanks to you all for coming out tonight.
Thank you. Back away from the mic.